Great, thank you. Hello, everyone. My name is Sudha Rajamani, and I'm a faculty in the bio department. We're just going to wait for a couple of minutes before we start today's events. I request you to please hang in there and just wait for a couple of minutes more. Thank you. Great, thank you. Hello, everyone. My name is Sudha Rajamani, and I'm a faculty in the bio department. We're just going to wait for a couple of minutes before we start today's events. I request you to please hang in there and just wait for a couple of minutes more. Thank you. Hey, Anurag, a bit of lag, Ray. Almost a couple of seconds ka lag. Oh, that much lag is there always? Okay, okay, okay. It is on mute now. I have muted myself. Okay, 5:30. I'm going to say we go. Yeah, Nikita?
Yeah.
Okay. A very good afternoon to everyone, and a very happy Women's Day to all of you that have joined us today. It is an absolute pleasure to have you all today at these celebrations that we have sort of put together as part of the Women in Science Committee at IISER Pune. The Women in Science Committee at IISER Pune was instituted towards the last part of Jan this year, and one of the first agenda items that was on our cards was to facilitate this event as part of the International Women's Day celebration. And it is my absolute pleasure to have you all here to hear this fantastic panelists that we have kind of brought together to sort of get together and discuss about how it's been to do science in the last 1 year, maybe even science forever, but particularly in the last 1 year. Without further ado, I'd like to introduce Nikita Gupta. She's one of our own. She is a BSMS fourth year student who is a role model in herself. One of the important goals of the Women in Science Committee is to showcase role models, particularly women role models, so that we get a chance to discuss about their journeys, learn from their journeys, and try and sort of figure out workarounds that women typically tend to face in STEM, in the STEM environment. And one other very important goal is to also bring about a gender equity on campus. And towards this, one of our first important roles was to get a student who plays one of these important roles to be the person to host today's show. And Nikita, welcome. I will let you take over from here.
Thank you, Sudha. That was very kind. Welcome to all of you. And I think we can start now. So the theme for this year's International Women's Day is Choose to Challenge. And I quote the website here directly, the International Women's Day website, that we can all choose to challenge and call out gender bias and inequality. We can all choose to seek out and celebrate women's achievements. A challenged world is an alert world, and from challenge comes change. So today we're going to hear from our diverse set of speakers, each from a different stage in their academic career, about doing science in unprecedented times. And we'll hear about their perspectives on difficulties faced by women, especially in this terrible year, and how they've witnessed the overcoming of some of these challenges. And with the theme today, we also hope to be able to think about what we need to overcome some of these deep-seated barriers that hold women back. And our first speaker today is Dr. Collins Assisi, an assistant professor in the Department of Biology at IISER Pune. Dr. Assisi is a theoretical neuroscientist, and his work focuses on modeling mechanisms of olfaction and spatial navigation. Just a second. We hope he'll tell us a little about his perspective as a scientist with a partner who's also a scientist and how they've managed their roles so far together. Dr. Assisi.
Thank you, Nikita. First of all, let me start off by wishing all of you a very happy Women's Day and thank the organizers for putting this celebration together. So I'm going to start my narrative by recalling this interesting conversation that I heard about 4 years ago. I was at a Society for Neuroscience meeting, and one of the speakers, a renowned writer and scientist, Siddharth Mukherjee, was interviewed on stage by Eric Nestler, who was then the president of the Society for Neuroscience. So Mukherjee is a scientist, he's a physician, he's a Pulitzer Prize winning author of 2 books. And Nestler asked him how he juggled all of these different roles, and not just juggled these different roles, he did so with remarkable success. And in response, let me just share my screen and put this image up here. So in response, Mukherjee quoted Chinua Achebe's debut novel, the title of his debut novel, which was Things Fall Apart. And the idea is that things are always falling apart. When you work on one thing, the other things that define your life fall apart. And as a scientist and an author, he attributed some of his success to learning how to let things fall apart and let it fall apart along some dimensions while determinedly moving along others. Now, letting things fall apart is something that many of us practice. However, it's really important to remember that this practice is also a privilege, right? And it's an enormous privilege that men have greater access to than women. And, for several of us lesser mortals who, unlike Siddharth Mukherjee, are only one or two things professionally along with being parents and, being part of a household, the things that we let go of very easily are the seemingly mundane tasks of keeping a clean house, of stocking the pantry, of making sure that we're not foraging around dinner time and so on, right? So the question is, what are the consequences of screwing up? What are the consequences of letting go? And one can ask whether women pay a greater price than men do. And the simple and unsurprising answer is yes, right? So let's sort of look at the numbers prior to the pandemic, and let me put this graphic up for a second. So this is a survey that was conducted by the National Statistical Office, and it's the first of its kind that's done in India, that looked at time use patterns. Uh, and the survey extended over a period from Jan 2019 all the way to December 2019. So exactly the year before the pandemic. And the survey was fairly comprehensive, right? It covered about 140,000 households, of which about 55,000 were urban and 83,000 were rural households that they surveyed. And the data pertained to it was collected, and it pertained to a 24-hour period in each household. People were asked during this 24-hour period to minute everything they did during a typical day, and they had to do this in half-hour intervals, right? So the objective of the study was to measure the participation of men and women in different paid and unpaid activities through the day. And the outcome of this survey is perhaps not surprising. You'll see something as simple as time use of as how people use their time is gendered, right? So women, it turns out, spend nearly 8 times the length of time that men do in attending to unpaid domestic services. And the key thing is unpaid domestic services, right? So out of the people surveyed, uh, it turns out that only 21% of the men surveyed said that they did any unpaid domestic work at all, and compared to a significantly higher proportion of women, nearly 80%. So if you, so that's one aspect, right? I mean, it's startling discrepancy out there. But of this 21%, if you also look at the times that were spent by each participant in this 21% of men, it turns out that uh, that number is also quite startling, right? So 94 minutes per male who participated out of 21% who participated actually did any unpaid domestic work. And now compare these 94 minutes to 293 minutes per female who participated in unpaid domestic labor. Right? So these numbers are clearly not necessarily surprising. I've also picked the urban and not the rural statistic, which is just as well, since the numbers are not that different, it turns out, across the urban rural divide. Now, it's quite well known that men tend to contribute more towards activities that are officially recognized and or rewarded as being valuable work. So, for example, if you consider the history of programming, right, uh, when programming became a lucrative profession, men predictably became programmers. And if you look at this 1968 book called Your Career in Computers, the book stated that people who like cooking from a cookbook would make good programmers. And remember, this is 1968, when programming was still a fashionable occupation for women. Now, by 1984 or so, men began to edge women out of programming courses, and computer science became a very male dominated enterprise. And this, despite the fact that the first compilers were written by women, they contributed to writing operating systems. The computing engines of yore were actually run by women, right? So one of the big stories in modern science, and I bring this up because we're talking about computers, one of the big stories is that of chaos theory, right? So, and related to this is the popular idea that if a butterfly were to flap its wings somewhere, then it could create a hurricane somewhere distant, right? Now, in fact, if you look at the birth of chaos theory, the narrative is that Edward Lorenz, who's considered the father of chaos, started a scientific revolution by tinkering with a computer that's known as the LGP-30, right? And his work in numerical weather prediction is the stuff of legend. In fact, his 1963 masterpiece, and that's the paper, has been cited thousands of times, and it's been taught a number of times in classrooms. Now, if you look at the acknowledgements in this paper, Lorenz had written that special thanks is due to Miss Ellen Fetter for handling the many numerical computations and preparing the graphical presentations. Now, the first time someone noticed this acknowledgement after the paper was published and dug a little bit deeper was very recently in 2017, right? So just a few years ago. And Lorenz is not a bad guy. He was in fact known for his humility, and in fact Fetter was surprised that she had even been acknowledged in this work, because that was not common practice at the time. So it should come as no surprise that women's contribution to important work has often been ignored, right? Now, however, the point that I'm trying to make here is that men tend to save their contributions for work that is considered officially important, right? And in my experience, and what we saw during the pandemic, is that activities that were not official, and I put the official in quotes, of course, that were not official, were peopled almost entirely by women. right? So for example, even if you look at IISER campus, so the job of finding food, of stocking the pantry, of communicating with farmers who delivered fresh produce, all of this was done by women. And we at some point also discovered that there were a group of stranded construction workers on campus, and everyone on campus, without regard to gender or hierarchy, expressed interest, and they contributed generously to the welfare of this group of people. In fact, many continue to do so. However, what's also interesting is that if you look at the people who were distributing the food, who were collecting and sorting the clothes that were distributed to the children over there, the doctor who was checking the health of the kids, all of these people were in fact women. Now, there were certainly more men who were volunteering in various places in the COVID testing center, for example, compared to the labor camp, right? Now, I'm not saying that women did not contribute to the testing center, far from it. In fact, some of the most prominent faces in the COVID testing center were people like Sudha and Midula and so many of our student volunteers. I'm also not saying that the men who volunteered and even ran the place did so because their intent was selfish, right? So that's it was entirely altruistic, right? However, the point that I want to make is this: that there is a gradation of activities in some perceived order of importance, and I believe that this gradation of activities is, in fact, gendered. And even our altruistic investments, it turns out, are gendered, right? So clearly putting all of this together from a one of a kind, seemingly irrefutable survey, historical example, and some immediate anecdotal data, one can suggest that women are disproportionately more likely to engage what the time use survey that I talked about and several other surveys characterize as care work. Importantly, unpaid care work, right? So coming back to Siddharth Mukherjee's narrative about letting things fall apart, it's highly likely that women are in fact more cognizant at this point of the consequences of letting things fall apart, and therefore they're less likely to indulge in the luxury of letting things fall apart. In a recent article that a friend shared with me, the article is interestingly titled "Dad, Wash Your Hands." So the authors of this article looked at how men and women perceive the threat of contracting COVID and the differences in their response to it. Now, what their study showed was actually quite revealing, right? They show that women and men assess similar levels of personal risk for contracting COVID. However, despite these similar risk assessments, women more frequently express a heightened concern or anxiety. Right? Now, this observation could be very easily swept under the centuries-old trope that essentially valorizes risk-taking men. However, the authors argue and demonstrate rather convincingly, in my opinion, that women's experiences of anxiety and distress are closely tied to their care responsibilities. So during the pandemic, more women than men reported having increased care responsibilities as they and their families had to adjust to disruptions related to COVID-19. Right? So what the authors argue, and I quote, is that the distance that men enjoy from close caretaking relationships. Let me state this again, that the distance that men enjoy from close caretaking relationships protects them from the fear and the anxiety that women reported. And the distance that the authors talk about is quantified in terms of the length of time that men and women under comparable circumstances spent in caregiving tasks. So here's the easy fix, easy in quotes, which is that equalize the times that are spent in care work. Right now, it's possible that we're already seeing some of the consequences of such disparities. The early indications are that men are more likely to submit papers to both the archive and bioarchive. Self-reported accounts of scientific productivity suggest that people with children to care for have experienced a greater loss of productivity than those without. In fact, the effects of gender disparity seem to be more evident when you look at the numbers of first authors rather than senior or last authors, right? So what this really implies is that the shrapnel from the pandemic is more likely to hit early career scientists, and as time may reveal, the women among them, right? Now, I should sort of turn my gaze for a moment to my own home, and like Nikita mentioned, and like some of my colleagues, I happen to have the good fortune of being married to a scientist and a colleague. So Suhita, like me, is a computational and a theoretical neuroscientist, and you could say that we end up playing in the same sandbox. So we probably have a better understanding of the demands of what our profession needs and what needs to be done, right? Than a lot of other people. And despite these seemingly idyllic circumstances, the pandemic hasn't really been a cakewalk for either of us, right? So we've gotten over time used to a certain level of support from people around us who work to keep the house clean and cook lunch every day and so on. And we've gotten used to the fact that our son would be occupied from 7:30 in the morning up to 3:30 late in the afternoon at school, and then at the end of it he could saunter into our office after school. He can get something to eat, he can go and play with his friends, and numerous other conveniences that we've gotten used to. And so we knew, of course, that work could carry on undisturbed for the better part of the day, barring, of course, self-created distractions. Now, with the pandemic, these intricate time calculations predictably went for a toss. And there was a lot else that needed to be taken care of, right? However, what I learned during this time, during the last year, is that while everyone at home tends to contribute towards taking care of things, it turns out that Suhita actually carries a large part of the cognitive burden of planning things. Now, I did not until recently realize how demanding this burden is, right? In fact, sociologists sometimes call these non-physical, they refer to these non-physical activities as household management. And these are typically mentioned only in passing. But it turns out, and some studies show this rather conclusively now, that cognitive labor, like physical work, is also a gendered activity. And it turns out that women do more cognitive labor than men. And however, here as elsewhere, what we do know is that the cognitive labor component that is most closely linked to power and influence, right? So most closely linked to perhaps deciding which school that your child will go to, these powerful and influential cognitive elements of cognitive labor invite more participation from men, right? So the pandemic was revealing in other ways as well. So my lab is a rather small one with a few PhD students and several undergrad students who together supply all the creativity and the elbow grease to keep my lab chugging. And despite challenges, one of the things that I learned is how remarkably resilient and determined our students are. On campus, things are to some extent scrubbed down and sanitized. We live in some sort of a monastery. But working from home where their worlds are whirling around them, we could still rely on students to give scientific talks, to run simulations, to concoct hypotheses, and most importantly, to remain interested in science. And some did this despite tumultuous personal changes going on in their lives. The it the practice of science does not happen in a vacuum. It needs a great deal of support, from the administration. And it was remarkable how many dedicated people we had across the institute, making sure that the necessary things got done. And despite the challenges, they showed up virtually, sometimes physically, when things were broken, fixed it, and quietly walked away, right? So it's as much as one sees the fractures in the pandemic, it's also wonderful to see things come together and hold steady as well. Now, the theme, as Nikita mentioned, of Women's Day is to choose to challenge, right? Because a challenged world is an alert world, and from challenge comes change. So what's the challenge? I guess one could ask, we should take up. And I was reading this recent article by the economist Ashwini Deshpande, who reasoned that large disruptions like wars and pandemics can have both negative and positive effects on the ability of women to participate in the paid workforce. So, for example, World War II resulted in a rise in female labor force participation in several countries. And this predictably also uh, ended up in changes in the distribution of household chores among men and women. And I understand that the early evidence in the Indian context, both in terms of sharing work at home and in terms of scientific productivity, seem to suggest that the negative effects of the pandemic are more prevalent than the potential positives. However, what I do hope is that by being forced to participate, many of us will realize and live up to the challenge of being equal partners and allies. And thanks for listening. That's over to you, Nikita.
Thank you so much. That touched on so many real things. I think I won't forget the expression to how women can't afford to indulge in the luxury of letting things fall apart. I think that's yeah. Thank you so much.
Thank you.
Our next speaker is we're very lucky to have her with us, Dr. Garvin Lee Kang, Professor of Microbiology at the Division of Gastrointestinal Sciences in Christian Medical College in Vellore. Dr. Kang was the first Indian woman to be inducted as a Fellow of the Royal Society in 2019. She's at the forefront of the field of epidemiology and has made major contributions to the development of vaccines for diseases like cholera and typhoid. Being a leader in virology, I'm sure she has a lot to tell us about doing science in unprecedented times. Dr. Kang, please.
Thank you for the introduction. I'm just going to share my screen, and I'd appreciate it if you let me know when you can see it.
We can see it, yeah.
Okay, so the theme for today is choose to challenge, and quite frankly for me, it's science in predicted times. It's also called I Told You So. So this is a paper that we published in November of 2019 talking about the need for changing how we do public health, the need for transforming education, the need for preparedness for pathogens that we did not know when to expect. So at the time of the pandemic, I was at the Translational Health Science and Technology Institute in Faridabad, 200 acres of a beautiful green campus in the Aravali Hills, large buildings. The government buildings are getting fancier and fancier, and the resources that are available within government obviously are truly phenomenal. And THSTI, by its very name, was the institute that should step up when there is a situation that requires solutions for epidemic diseases. And for us, in fact, we had started work on this about 3 years earlier. An organization had been set up called the Coalition for Epidemic Preparedness Innovations. This was a partnership between the government of Norway, the Wellcome Trust, the Bill and Melinda Gates Foundation, the World Economic Forum, and India's Department of Biotechnology. The idea was initially that India would be a full partner. It didn't, well, I had this interesting experience of going to the Ministry of Expenditure to make the argument that we should be investing in CEPI because we will have problems that will happen. So this was in January of 2018. So I went there and I said, you know, we have Nipah in Bangladesh. We have had Nipah in Bengal. We may have Nipah at any time in this country. We had Nipah in May of 2018, but anyway, the bureaucrats in the Ministry of Expenditure were not impressed by my arguments. So it took another year of continuing to argue to finally get approval for a program that is now called INDCEPI, and it is across the Department of Biotechnology's National Biopharma Mission and the Translational Health Science and Technology Institute, and it seeks to do exactly what it says, contribute to public health preparedness in India by ensuring that we can have vaccine candidates against those agents that cause emerging infectious diseases. So with this effort that had been going on through 2017, 2018, 2019, we had just got approval for INCEPI and for a number of facilities that we thought were critically important for supporting new vaccine development. Not all of them wound up getting approved. Budgets, as is usual in the government, were significantly slashed, but at least the idea was there and there was a limited amount of resources available. So that was the start of 2020. What did we need to do? For me, it was very clear. I had to choose whether it was, we will develop our own vaccines, we will develop our own products, or should we create an ecosystem that supports other people to develop their products? And I'm a firm believer that, you know, you can be in the background, but if you support and you support with rigor, that is much more service than developing a product on your own that is going to be slower and take much longer to go through the entire development cycle. We decided, because it was important to government to say so many candidates were in development, to start a development program, but to majorly focus on developing the animal facilities and developing the laboratory facilities that could be utilized across vaccine candidates. Because with viruses, it's very clear that you have to aim for a vaccine to prevent disease, and especially for SARS-CoV-2, which is a virus that spreads asymptomatically. the standard public health measures of isolation, quarantine can work only to decrease infection, will not wipe out infection as they did in SARS, where SARS was able to spread only from symptomatic people. So understanding disease was important. Understanding what tools we had to bring to the table was important. I spent much of February last year trying to tell the world there is a problem, we need to be ready, we need to prepare for this. I gave the talk at National Science Day last year on February 28th about viruses going and infodemics going viral. Felt for the next 3 weeks like nobody was listening to me, no matter how much I kept saying there is a problem, let's do something about it. But then we wound up with the lockdown. So it's like going from one extreme of nothing is happening to the other extreme of nothing can function now. So now to work during a lockdown, remember that first diagnostics was allowed to be done only by a limited number of ICMR labs. And then they open it out, but the country is locked down. So you can't get hold of reagents. You can't get hold of anything. We had dreams of planes being flown from Korea with diagnostic tests, but we really struggled. I think in some ways being at THSTI was a big advantage because we were close to an international airport, and at least there were some flights coming into Delhi. So very occasionally we could get a few reagents in, especially after towards the end of April. But beg, borrow, steal is always a good principle to apply to science, and I'm very good at pleading with people. So we managed. It was also a big choice to make: keep students on campus or send them home. And I used my public health reasoning: 200 acres isolated from the world, no transport in or out. The students are safer on campus than not. We had a neighboring institution that chose to shut down completely, but at THSTI, we continued to work throughout the lockdown. Of course, incredible exercise to get permissions from government to be able to work during this time. But we managed it, and I think because we were able to do all of this, THSTI now has animal facilities that have supported multiple vaccine candidates. THSTI has a laboratory that is one of 7 globally recognized laboratories for testing samples that come from SARS-CoV-2 vaccine trials. So it's a standardized global networked platform that will provide quality services to vaccine, that is providing quality services to vaccine manufacturers, not just in India, but wherever they are located. So I think that was the choice about leading or supporting, and the support, I think, has been very, very valuable. The other thing that we decided to do was set up a cohort of patients, and uh, uh, kind of pushed the team very hard that if we have clinical teams, you need to identify people who are infected and get them to agree to be followed up for long periods of time. So we started, including getting IRB approval and everything. By April last year, we were recruiting a cohort, and that cohort now has about 3,500 people under follow-up. Has been, so there are samples in acute infection and convalescent infection at 6 weeks, 6 months, and the idea is to continue to follow these people up. But the samples from those individuals also serve the purpose of supporting diagnostics companies to evaluate their tests and do it in a rigorous fashion. So 30 companies were supported to evaluate tests, and really well characterized samples, so much so that FIND, the Foundation for Innovative New Diagnostics, has asked THSTI to be a partner now. So not only vaccine companies, diagnostics companies are also supported, and international agencies, including WHO, are partnering with THSTI because we have the people, we have the samples, we have the cohorts. The we is a royal we because I left THSTI in August of 2020 and came back to Vellore. So why did I choose to do that? Well, actually, it was getting, so in THSTI, I wasn't doing science, I was doing administration. And the amount of paperwork in administration is really a lot. And I find that frustrating. So I wanted to get back to a group where I could focus on actually running research projects on my own, which I hadn't done for 4 years. So I figured that scientists at THSTI are now really well positioned. They have a good platform. They are very capable people, can handle things on their own. It's time to go. So I came back to Vellore, and it's my home, and it's my personal home as well as a scientific home in a way. So coming back a little bit about what I think of vaccines and where we are, since this is something people generally want to hear about. I think we forget that 2020 was the year with the most forest fires in the Amazon, in Australia, in the Western US. It's the year where we lost a large part of the Arctic ice shelf. It was the year of coral bleaching. It was one of the hottest years on record. And it was the year of a virus. But this was not unexpected at all. As I said, this was something that was predicted. Over the last 30 years, we've just been having outbreaks after outbreaks. And why are we having these outbreaks? Because we are changing the environment. We are changing the way we live. With deforestation, with climate change, you are going to have a greater amount of animal-human contact. With travel, with migration, with the kind of urban influxes that we are seeing that are resulting in increased population densities, you're going to create situations where any agent that is easily transmissible, and respiratory agents are the easiest to transmit, you will see spread. So we've seen this from AIDS to Zika and now to SARS-CoV-2, which is only the 7th coronavirus to get into humans. Now, thinking about the disease, this is an unusual virus, because it goes so many places. It spreads easily because it's respiratory. It most likely has a very small infectious dose. We don't know exactly what the infectious dose is, but I'm willing to take a bet it's less than 1,000 viral particles. It spreads from person to person. You manifest with symptoms in about 5 days. It takes about a week for the disease to become severe. And it's a small proportion of people that become symptomatic, and then a small proportion of those people that become severely ill. But when you think about timing of treatment and the location of treatment, it's very important to understand what stage of illness you're treating at. So if you want an antiviral, you want the antiviral at a stage where the virus is replicating. By the time you are 1 week into symptoms, antivirals no longer make sense. Now you need to be looking at the other pathogenetic mechanisms and addressing those. And that's why we are now using anti-inflammatories and anticoagulants in people who develop severe disease. Now, we heard hydroxychloroquine, the wonders of hydroxychloroquine, the wonders of ivermectin, the wonders of many drugs, both from traditional and Western medicine. And it makes sense. Repurposing is the fastest way to get a drug. Sorry, that should read fishing expedition. But repurposing is really, I think it works. Let's try it and see. And that's fine as an approach, but it needs to be done very, very rigorously. So this time last year, China had 120 clinical trials. None of them completed recruitment. India has more than 100 registered trials. Most of them are recruiting 100 patients, 150 patients with a disease that is so protean. How are you going to get an answer from 120 patients? You don't even get a clue whether anything works or not with these small numbers. So results are robust only when you have large multi-center trials. And if we are to think about quality of clinical research, that is something that we need to emphasize. But quite frankly, I don't think treatments have gotten the attention that they deserve. All the focus has been on vaccines. I love vaccines. I'm a huge proponent of vaccines, but I think we haven't been very balanced in our approaches here. Now, if you think about why vaccines, well, actually, we controlled SARS without a vaccine. We controlled it with just barrier nursing, screening, and quarantine. If you could isolate a patient, and we wiped out SARS from 2004, we haven't seen a case of SARS. And all it took was really good infection prevention. But we can't do that for SARS-CoV-2. And that's what I said at the beginning. It's because it's asymptomatic infection. Now, there have been other outbreaks before, and the case of Ebola is one that I think is very important to understand why we were able to respond to SARS-CoV-2 so quickly. And really, it was because for Ebola, next 12 years. So that when Ebola hit, the vaccine existed. But the vaccine was not used because the world couldn't get its act together to figure out how to use the vaccine until the epidemic was almost over. Then when they evaluated the vaccine was a fantastic vaccine, prevented disease completely. So why had the vaccine not been made? The vaccine had not been made because Ebola and outbreaks are unpredictable. If you don't know how many people are going to be infected, how many people are going to need the vaccine, which country this outbreak is going to happen in, because you need all the regulatory approvals to get your vaccine into the system. And vaccines have a shelf life, they expire. So if you have a completely unpredictable market, why would you make a vaccine? And that's what had been happening. We had lots of vaccines in early stage development that never got taken forward. And Ebola was really a wake-up call for the world. Now we have vaccines. We have lots of vaccines. We have new technologies for vaccines, exciting systems where you're delivering message instead of giving proteins to people. And we now know that these vaccines are working. So lots of platforms, but the question is, how did we get here? 20 years, and the second is organizational preparedness following Ebola. Bill Clinton set up a part of the National Institutes of Health called the Vaccine Research Center, where the idea was to make an AIDS vaccine. They have not made an AIDS vaccine yet. But what they have learned from studying other viruses has led to vaccine science like we've never had before. So this is an example of the respiratory syncytial virus, where you can make different kinds of antibodies to different protein structures. So the glycoprotein of RSV is the protein to which you want to make a vaccine. But the question is, do you make it to the pre-fusion form of the glycoprotein, or do you make it to the post-fusion form? Post-fusion is after it has attached itself to host cells. Well, figured out that we actually needed to the pre-fusion form, but unfortunately all previous vaccines had been using a stabilized glycoprotein structure that was in the post-fusion conformation. So learning that you need the pre-fusion form and then being able to do protein design that made stable proteins that induced a good immune response was good learning. And this was applied subsequently to other vaccines as well. So the spike glycoprotein for SARS-CoV-2 is actually stabilized in the pre-fusion conformation. The second was organizational preparedness following Ebola, where the Coalition for Epidemic Preparedness Innovations that we mentioned earlier was set up. And the idea here was, if we have vaccines, can we get them ready, get them into humans, and be prepared for outbreaks when they come? And fortunately for us, CEPI had been established in 2017 and had in 2018, 2019 started to make vaccines against MERS coronavirus and against disease X, which is really platform technologies. And the idea, so when you had somebody already working on a MERS vaccine, it was very easy to tell them, switch, work on a SARS-CoV-2 vaccine. And that's essentially what was done. CEPI funded 4 vaccine programs in January of 2020, including Pfizer or BioNTech, Moderna, and Oxford. So we have vaccines that work. In May of 2020, we thought we were being very ambitious in putting a target product profile for a vaccine that would have 50% efficacy, which is ambitious for a mucosal pathogen. For influenza, over 50% is a good year for flu vaccines. And a vaccine that could be used in 2 doses and gave protection for at least 6 months. We are at a stage now where we have 4 platforms where we have vaccines that work. mRNA, adenovirus vectored, inactivated vaccines, and subunit vaccines. So it's really been phenomenal science and phenomenal cooperation. So what worked? Preparedness, CEPI, WHO, everybody got their act together. The second was we threw money at the problem. Every problem that could be solved by giving funding was. You have 4 candidates, let's test all 4 candidates. We'll see which one works. Let's do phase 1 and 2 together. Let's do phase 2 and 3 together. And the regulators cooperated by shortening their review processes and time. And that's what resulted in our ability. So nothing has been shortchanged. In fact, some of the work that has been done is much, much more than we would ordinarily do in a phase 3 trial. And the result of that is successful candidates that are in use now. So what does the future hold? We made vaccines in 10 months. We can do it in less. We need to get people vaccinated as quickly as possible, even as we continue with non-pharmaceutical interventions. I think it's very important to emphasize, we are worrying about variants, right? But a variant will only arise if the virus is multiplying. So if we suppress replication of the virus globally, it's not replicating, it can't mutate. We won't get new variants at the speed at which we are getting them now. So vaccination, really important. Test, trace, and isolate, really important. We need more investment in basic virology. India, our surveillance is rubbish. We have one surveillance system for every disease, and they don't talk to each other. When you're looking at respiratory pathogens, why can't you be looking for all respiratory pathogens together? We don't do that. And clinical research, we are truly pathetic. It isn't just small-scale clinical trials. We've had plenty of examples of even the vaccines that have been evaluated in vaccine in India, where we have had issues with institutions. We have had issues with companies not responding to the genuine concerns that people have about what has followed their entry into a trial. And that, to me, speaks to poor quality clinical research, ecosystems that are not used to designing and doing studies in India. Our vaccine companies are phenomenal manufacturers, but I think it's our responsibility as researchers, and hopefully for the government as well, to think about making an R&D system that is ready for the next pandemic. So I will stop there, and thank you for inviting me here.
Thank you, Dr. Kang. We have a few minutes, and there is a question. I will read it out. This is from Jitesh. I want to ask Professor Kang if she is observing the seeds of the sort of cultural preparedness we need for future pandemics. What entities have shown the greatest such change?
I think, people say if you don't learn from history, you're condemned to repeat it. I am very scared we are going to repeat it. So we have this ability to not learn. CEPI was a learning because after H1N1, we realized that the world, H1N1 showed us that rich countries will corner vaccines. That's what happened with the H1N1 vaccines. We saw from Ebola that we can have products that won't be used to address problems of the developing world. So we now have a system called the COVAX facility. So the gap between rich countries and poor countries has been reduced from the usual about 10 years to get a vaccine to 11 weeks. But we are still not going to have enough vaccine that is going to go to low-income countries. In India, we are very fortunate that we won't have a constraint on supply at all. But I think in terms of diagnostics, in terms of surveillance, in terms of preparedness, I'm not sure that I'm hearing that we will respond to this pandemic with better preparedness.
Thank you. Thank you for that. I'd encourage more people to put questions in the chat, and we can take them towards the end. Thank you, Dr. Kang. Thank you so much. We now have a few more speakers. Before that, I'd like to add that the theme chosen for today by UN Women, which is the United Nations entity for gender equality and the empowerment of women, the theme chosen by them is Women in Leadership, Achieving an Equal Future in a COVID-19 World. And I thought I should just mention it here after Dr. Kang's talk, that women must have the opportunity to play a full role in shaping the pivotal decisions being made right now as countries respond to and recover from the COVID-19 pandemic. Choices that will affect the well-being of people and the planet for generations to come. And now we will have Dr. Ananda Sinha, or Rana as he's popularly known. He's a professor in the Natural Sciences and Engineering Department at National Institute of Advanced Studies in Bangalore. His interests range from cognition in primates to conservation biology, and he's also been Dean of Academics for 8 years at NIAS. Dr. Sinha.
Thank you very much, Nikita. Thank you very much, Sudha, for this great honor to be here. I must say that I apologize for not presenting any academic perspective in the comments that I would like to make, but it would be a sweeping sort of glimpse into my thoughts and emotions on this day, one that we have called International Women's Day. And if I were to give a formal title to this commentary of 5 minutes, it would be "To be or not to be a woman?" That is the question. Some reflections on COVID-19 and our lives in togetherness. It was in August 1998 when my spouse, Kapuli Mukhopadhyay, and I plunged into parenthood. We adopted a pair of twins, a girl and a boy, 8 days old. We were both 38. We had been married for about 6 years, but we had been close friends for about 25 years by then. But nothing had prepared us for this. We had no support system and soon fell into what I would say a functional, though a very difficult routine. She went to work at her job as plant biologist at the University of Agricultural Sciences in Bangalore on Tuesdays, Thursdays, and Saturdays. And I went to mine as an animal biologist at the National Institute of Advanced Studies, also in Bangalore, on Mondays, Wednesdays, and Fridays. But 3 years down the line, we realized that one of us would have to stay at home. And Kapuli decided to do so. After much thought, after much discussion, after much argument. Yes, she did, in a sense, and within inverted commas, sacrifice her all too important at that time earnings, if not her career, but she had always believed that this was the right decision because she had a choice to do what she thought worked best for her at that moment. And that was and continues perhaps to be the most important aspect of any decision that she as well as I make the right, the capacity, and the opportunity to choose what we would like to do. Subsequently, Kakuli and I began to work together on studying bonnet macaques in the Bandipur National Park, a joint project for 20 years this year. Our children have also been an inevitable part of the fieldwork for about 14 years of this project, from the age of 2 till they turned 16, since when they have run the house on their own while we've been in the field for prolonged periods of the year. And then COVID-19 struck. It has truly been, I think, one of the most remarkable years of my life for one simple reason. It made me wonder about our gender identities, about our roles, and whether I was again, within inverted commas, man or woman or both. When any instrument or machine broke down during the lockdown, the man about the house, who else but Kakuli, in her infinite wisdom of all things mechanical and electrical, repaired them all. And should any stranger selling any kind of household goods or perishables call, I, with my infinitely feminine gentleness, diplomacy, and politeness, was called to action. The rough and tough Kakuli had neither the patience nor the grace to deal with them. And that brought home to me in no uncertain terms and times something that I knew all along. Kakuli had always been the husband and I the wife in our marriage, whoever went out to work. Absolutely no doubt remained about that anymore in either her mind or in mine. And so where does this put us on this International Women's Day? We must, of course, remember that 8th March was originally marked as a day of protest, not of celebration in 1913, when women across the world campaigned for their rights to work, to vote, to be trained, to hold public office, and to be free of all kinds of discrimination. And accordingly, I think we must consciously strive, not just on this day, but on every day, for a world free of discrimination, hatred, and violence, not only against women, but against every individual, for we know not who they represent, man or woman. And so as a biologist and as a virus-driven androgynous individual, all I can say is that we should use such days to also think more deeply about ourselves, about our own duties and responsibilities that we must bear, how we should behave towards others, what kind of freedom we give ourselves and others, and therefore about our own positions in this continuum represented by gender. For I challenge any other biologist here or anywhere to define for me what it is like biologically, psychologically, or culturally to be a man, or for that matter, to be a woman. Thank you very much.
Thank you so much.
Thank you. Thank you.
We have next Dr. Shanti Kalipatnapu. She's the head of research communications at IISER Pune. Dr. Shanti did her postdoc at University of California, San Diego, in membrane and receptor biology. With her interest in scientific writing and communication, Dr. Shanti has carved a very unique and indispensable niche in academia. And she handles IISER's social media presence, the newsletter called Impact, and also handles IISER Pune's website, amongst other things. Dr. Shanti, please.
Thanks, Nikita. Hi, everyone. Been enjoying these diverse set of talks. They've really touched upon very different aspects of both being in COVID-19 times as well as what does it mean to be what we are in these times. And first of all, I would like to thank the organizers for having me on this discussion. Given the nature of my work, which is in research communications, some might wonder what I'm doing here. So in the next few minutes, which I hope I would be able to give you some pointers in this direction to answer that question. I would also like to recognize that the composition of this panel is inclusive in many ways, and would like to commend the organizers on attempting this format. I represent a growing community of professionals contributing to the research ecosystem in ways that are less obvious. 10 years back, when I chose to pursue a career in science editing and writing, I had not viewed this in that frame back then, but I was actually challenging my own vision of a career in store for PhDs, which was amply colored by the predominant vision of what a career for a PhD means in academia. As a result, the early years in this new career that I took up in editing were both exciting and excruciating in equal measure. I have to acknowledge the support that I received from my family, and it made this easier to go on this path. But I don't quite know what it is like to choose to challenge in the absence of such a privilege. But I can only imagine the inner strength and determination that such a task would entail. The pandemic has indeed brought upon us unprecedented times. It brought several of us to the edge in a way that replaced hesitation with clarity of thought. It forced us to pick sides and led us to find some of our friends and family on the other side. Now, during the pandemic, many researchers and science professionals came together to fight disinformation. Some went out of their way to begin new research on COVID-19. Some used this time to write up papers that were waiting for long on the back burner. And apart from a sense of social responsibility that many displayed, they were all trying to respond and reach out in the most productive way possible at a time their regular research activities came to a standstill. Now, my work and my schedule were disrupted too, but not in any of these ways. We needed to realign our communication priorities at work. And importantly, we needed to make sure that our reporting was responsible and it did not raise false hopes. So as institute representatives, we were careful and measured when talking about COVID-19 related research, while at the same time facilitating the contact between researchers and the media to the best of our abilities. Now, we had to find ways to minimize delays at meeting deadlines in spite of the lockdown related restrictions. And I should also mention the support received at the Institute from the leadership and from the administration to make flexible schedules possible in meeting these, in overcoming these restrictions. Now, the bigger challenge, however, was more at the home front. To manage online school for my 11-year-old. So both as parents would take turns for this new activity, somewhat like how Rana had just described. We had these days of the week where we would, divide the work involved. So, but we were not sure if we were enough for this. We did need to seem to require the entire village to help us, except that everyone's busy dealing with their own issues and everyone's indoors. So as the lockdown eased, we were able to reestablish some of these connections and were able to get help for domestic work. And things did get better, but this still remains a challenge and we are really eagerly waiting for schools to reopen. Amidst all of this, I surprised myself when I was able to make time to anything other than work and home. I was actually able to write and I was able to support a few voluntary activities, which I did not think I would be able to do at all. Meanwhile, elsewhere in the city, in the country, and in the world, we have seen many situations of crisis, lives and livelihoods lost, blame game on, and intolerance on the rise. Even intolerance against intolerance is rising. This brings me back to the topic of inclusivity and diversity. How can we include more voices in this discourse? How can we communicate that it is possible to be more accepting of other cultures while respecting our own? And well, how does one come to define our and other? So I feel that gender-based discrimination that women face is a lot to do with a culture of disrespect. And it is the assumption of supremacy of our method or our profession, of our culture, assuming that there's something noble about pursuing science, for example, in comparison to other fields such as, say, art or business or HR. Now, we need to challenge these paradigms. And 2 points that I would like to make are that we cannot treat women empowerment as a standalone issue. We need to address our conscious and unconscious biases within ourselves, be they based on gender or caste or religion or financial status. And yes, surely we need to celebrate women's achievements and we need to have role models. While we do so, how can we be inclusive of all genders? When we celebrate a scientist's achievements as that of a woman scientist, are we doing justice to the hard work and the determination and the work that has gone into it? Because as far as I see, we have no role in choosing our gender as opposed to our contributions to science or our profession. So when we hold women-only events as an answer to manners or to make a point, I feel we are leaving out many friends and supporters for the cause of inclusivity. We need to nurture a culture of respect, be more inclusive, find alternatives to calling out. We need to find also, we need to find ways to call in as well, to bring in more people into the conversation rather than shunt them out, and more ways to bridge gaps than to broaden them. I feel, over the last year or so, as more and more voices are seen in the media in protest against discrimination, we also, I feel, this is a time for reflection as to understanding the reasons behind the discrimination, and also understanding how we can incorporate more and more voices in our conversations. And it is actually in this context that I recognize that the choice of this composition of this panel itself is one such a small effort. And thanks a lot for all of you for having me here.
It's a pleasure to have you, Shanti. Thank you so much. Our last speaker is the youngest. It's Swapna Joshi, who's a fourth-year PhD student in the Department of Humanities and Social Sciences at IISER. She works with Professor Pushkar Soni. She's interested in architecture and is currently studying temples around Lona Lake, which is a National Heritage Monument in the Buldhana district of Maharashtra. Swapna, please.
Thank you, Nikita, and really thank you to all the organizers for giving me this opportunity to echo a few of the student thoughts. So I basically come from a non-natural science field. As Shanti mentioned, whatever discussions about science have been happening here, I am diverting a little bit from there. Currently doing my research in a science institute and hoping to trail my career in a field where literally but happily life is in ruins. In circumstances where it was difficult for people to fathom the fact that digging up history could be a potential career, family was not sure why I particularly want to bruise, tan, and dirty myself every day. I was not sure if this will earn me a bread and butter. I consciously chose archaeology for the joy of rugged, broken fragments. At first, many thought I was to become quote unquote female Indiana Jones in future, because archaeology is all about treasure hunting and people may not know of a woman from actual field to compare with. Because which girl from a good, stable background should willingly pick up an axe and trowel to dig mud? Stories from field are entirely different. Generally, it starts with we girls suggested to be accompanied by males or elderly from the family for safety, not traveling alone but in a group, halting at places where we would attract least attention, unhygienic restrooms are minor adjustments expected from you. Since I work on temples, as Nikita mentioned, a very common advice is to not enter a temple during my menstruation cycle. Many times temples are in a bad state of preservation unclean surroundings, but the women are expected to be pure. Interaction with women, in fact, in rural areas were an eye-opener. I empathize with young married women or adolescent girls who probably didn't have the choices in their lives. It's a realization that I'm in a privileged position with a concession of self choice and decisions. We share a glance often, realizing there are struggles for both of us. While she is probably admiring me for my attire, independence, and a sort of carefree life that she probably yearns for, I am an urban girl grown up in a concrete jungle who finds solace in the temple and ruins in her backyard, but cannot make her surroundings mine. As COVID-19 pandemic hit the world, from living in a single occupancy hostel room within a research institute, I was now shifted with two housemates whom I call mom and dad. Suddenly, the schedules of these rediscovered partners were revolving around each other, and new timetables had to be set for the house wheels to run. To begin with, we three struggled a bit through this sudden reunion, but I was definitely blessed to have them take the load. Yes, not share, but take the load. I definitely learned that my homemaker, my mother, is the driving wheel of our house, and I, being the other woman in the house, cannot in any way share her load completely or keep myself in her shoes. All me and my dad could do were help her out to the maximum capacity with all the chores that we knew or the ones that we could quickly grab. But she, being the whole and soul, was at the forefront always. Work-wise, all this while, field, travel, survey, everything was largely reduced and still is to a single screen. A discipline in which library visits and field work are my major methods of data collection and analysis, it's now restricted only to e-resources. And mind you, suddenly I'm seeing my skin lose the hard-earned tan. Research work pace has slowly gone down, and I'm gearing up, but means have largely changed. Tangible objects, experiences, tactile in nature, have to be observed intangibly through photographs and other means. Not having any lab work in these times definitely helped. An independent project to work on gave me my own choice of time and place. But one loses the zest having been removed from the academic surroundings or like minded people. Field trips that came with their own issues already now had to be stopped completely. Even when partial travels were permitted, families were not sure if travel was safe enough.
Thank you so much, Swapna. Actually, all the speakers have shared such personal stories. I'd like to thank all of you again for opening up like this. It's very heartwarming to hear it, but it's also sad because some of the stories are sad. And I think, yeah, if you could all stay, we could talk some more and we can have our panel discussion now. The chat is open. Those who are attending, please ask questions. Those who are watching the YouTube live stream, please put your questions there and Sudha will read them out. To get things going, I guess I could ask the first question. This is to the men on the panel first, and a sort of personal question. So I have a younger brother, and I realized that growing up, sometimes you just don't see the privilege that you have. And even if he wants to help at home, sometimes he just doesn't know what to look for and how to help. And for him to see, I had to point out a lot of things. I want to ask you how what your journey was like to sharing the load, and because maybe it's wrong to assume, but you probably grew up in homes where most things were done for you by your mothers. Collins, I guess you could go first.
Okay, so right in that a lot of things were done by my mother because she was at home while my dad was working. So, I think despite the fact that he was at work, he was a very involved family person. And I think he did. I should be careful. So no, I didn't grow up doing a lot of things around the house. My mother did most of the things around the house, and therefore, one of the big issues, of course, is recognizing around the house, and I sort of credit the. To some extent, my dad, whenever he was around, would be helping. To a great extent, the women in my life who are involved in science, who have been sharing, being part of this whole enterprise. There was a reason I was floundering, and the reason I was floundering was because if you ask most men, they would immediately tell you about how equal their contribution is to the household. And this turns out to be pretty much everyone you ask. And when you look at the numbers, that's 21% participating in the domestic unpaid workforce. So where are the rest of us is the question. And so when you ask the question, I wondered for a moment what the degree of equality would be. But nevertheless, I do have wonderful role models that I have been able to follow. Yeah.
Thank you. I think Professor Sinha can go now.
Yeah, thanks, Nikita, for the question. I'll be very brief. I grew up in a household with my parents, both of who were working people, and my mother was a very, very tough woman because she had struggled all through life. She was a self-made person, and so she made sure. And I don't know whether she was driven by conscious thoughts and action, because I remember when some of my girlfriends asked her, "What do you think of women's liberation?" and she said, women's liberation is not just marching in the streets, though it may be required at some time within the household. It is to be firm and take your own decisions, whatever be the challenges in front of you. And I think that's where freedom lies. And I think, and which is why perhaps I did all the household work I could from my childhood. I washed vessels, I made the beds, I did everything. And I remember my father was also an extremely, he used to work outdoors, but whenever he was at home, he had to do certain things. He had to put the dishes into the sink, he had to perhaps rinse them out. And so all of us did it. However, later in life, of course, as I said, we adopted a pair of twins, and we realized, and I realized at that point of time, that if I didn't put in my effort, even if I did not enjoy changing nappies, there was no way these two children could be brought up. So it was as simple as that. It was a need, right? And finally, I think, Nikita, what I would say is that somewhere deep down, the change comes from within you, right? It's when you think, when you become non-judgmental, when you start thinking that every action, every task, every duty is fine if I carry it out. And if you have no expectations, which is really the toughest part, it's not that when I come home from work and my spouse has also come home from work that she will make the tea for me. Once that expectation went away, I think life became much more easier in a manner of speaking. So I think there are several, there is experience, there is perhaps learnings, and there is deep thinking and exploring oneself, through which I guess we become in some sense equal partners. Though I agree with Collins that perhaps equality, at least in the domestic sphere, is defined best by the people participating in it. It may not be possible to generalize it, but perhaps we need to set these equations for ourselves. Thanks.
Thank you. Thank you so much. I think Sudha had a question in mind.
It's a question to all the panelists, actually, all the speakers of the event today. I was wondering if you'd be willing to share potentially it could be a very personal thing, so the ball is in your court. I was wondering what it is that really stood out for you in this last 1 year. One incident or one aspect of having to work during these unprecedented times that really kind of stuck with you, and what was the kind of workaround did you find? And I mean, this way I feel like we can let people know that, everybody's been facing the same kind of a circumstance, irrespective of where one is in their career and at what stage one is in their career. So it'll be really nice if you could share anything that kind of stuck with you, and if there's any sort of workaround that really worked for you that you'd like to share with all of us. And sorry, I'm fumbling a little bit. My heart is still racing. I've never had to lock a meeting, kick people out and stuff. Man, I really shaking. But if you can take this question, that'll be awesome. Yeah, thank you.
I think we can start with the youngest, Swapna. Would
Yeah.
you like to go?
Sure. I think I'm speaking for many students when I say this, that of course we thought about our PhDs, why we started it, and the jitters in our stomach about where it is going, where is life going, as it was for everyone during COVID. But so when I sat and actually thought about it, as Sudhaman mentioned, what led me through this was, I think as I mentioned, the solace and the silence that I feel when I visit structures. I'm still not sure if I will be a good researcher, or if I'm doing the things correct that I should now. But my basic thing which starts of doing this work, of visiting places, is that I find happiness. And I guess trapped inside the house, that happiness was lost. So I knew that I have to get through this, so that at the other end, when I move out of this trapped lockdown, or the whole world moves out of the trap, I can again go out and visit some stones, some temples, some research, some work, and keep things ahead.
Yeah, I think we all found something to hold on to. Otherwise, this is really hard to get through. I will not try to guess the rest of your ages. So if you could, Shanti, do you want to go?
Yeah. So I would just like to add that we are still trying to overcome. It hasn't been overcome yet, but some of the things that I found helped me are to decide for myself what is important for me. Is it really important that the dishes get cleaned right away? Is it okay if they lie dirty till the morning, till the afternoon? So I think these sort of decisions, small decisions, but they can make a difference in how you feel about yourself, or how you feel about whether you're doing a good job. So some of these expectations, if we set ourselves up to it as if this is my job to keep this clean, so I think we are setting ourselves up for disappointment, is what I feel, because it is hard for anybody, a person of any gender, to be able to accommodate all of these requirements within a certain given time, given the time constraints. So I think that really helped me to consider what exactly is important and what should bother me and what shouldn't bother me. It also, of course, helped me to spell out, not just me, but for the others in the household also. I remember we actually seeking inputs from within members of the house, as to what is it that they're finding difficult and how it can be alleviated. So whether it was to my husband or to my son, and also spelling out the possibilities clearly, what is possible and what is not, so that expectations are a little clear for everybody. This did help me and the household, but still, yeah, the dishes are still dirty, so one has to deal with that. Yeah.
Thank you for that. I think communication is, yeah. I had a similar talk. I mean, we had a similar talk in my place for dividing responsibilities and making expectations more clear. So I completely echo that. Collins?
Yeah. So, I think one of the things that really stuck with me over the last year is a very brief glimpse uh, into the life of a student. So we were conducting our PhD intake interviews online in the last cycle. And typically during these interviews, students come over, they stay in the hostel or wherever else nearby. They walk into the room perfectly coiffed, and you uh, have a chat with them, and some make it through, some don't, and all of that. But this time the interviews were somewhat unusual, because you could see the life of these students evolving in the background. And one that really struck me was this candidate. She was on my panel, and she didn't show up for the interview. And I tried calling her up several times and figuring out what's going on, and she wasn't picking up the phone. And after a while, it got a little bit irritating because we had to move on. And then finally, I was able to get in touch with her, and she came on to do the interview. And she was doing this interview on a mobile phone. She was surrounded by, this was in she clearly lived in a slum. She was surrounded by squalor. You could see that uh, it was really difficult circumstances that she was coming through, and you could see, you had a glimpse of all of this in the background. And to me, what really struck me was that we sort of seldom get a look into each other's lives, and it's very humbling to see how hard it is for uh, some of us to pursue the interests that we choose to pursue. And this really stuck with me over the last year.
Thank you for that. I think that's Rana is left.
Yeah, I wanted to sort of take this, Sudha, thank you for that, for raising this, but I wanted to take it out of my professional sphere and bring it back into the domestic. And I think one of the greatest, I don't know, one of the most difficult moments that came up fairly early on in the lockdown and when panic was spreading about the infection is your own personal safety vis-a-vis the lives of others around you, right? And this was brought home to us in two very dramatic ways. One was, of course, our domestic help, who would come running almost every second or third day in spite of the lockdown, because the police in the informal settlement that she was living in would not let her go out to even go to the market, right? These were the early days and everyone was so zealous about the lockdown. And she would come home to our home to just gather foodstuff, to take things that she needed for her home. And so we got into this practice of keeping food for her and for another individual who was in a way dependent on our family right through. And that's when you start thinking a little less perhaps about whether we are really going to get the disease, to how will people survive even without the infection. Second, I stop buying from incredible. We saw our selling fruits
Rana, can you repeat
during those days. And he, of course, down lifted. I was just saying that one of the most striking moments was when we had this, of course, in our locality, nobody was going out to buy from them, but we made it a point to do it when we realized that right, his shop had closed down. He had no business, and he got a cart and was selling fruits just to make an earning. And that's how lockdown has impacted others so much more than they have affected you. I mean, your sort of, we were fortunate, we were lucky, we were at home, we had resources, we had the police wouldn't chase us with lathis. And that's when you realize what a difficult world we live in, if not for us, for so many of us. Yeah, thanks.
Nikita, can I quickly go ahead and read out something that Momita has commented
Yeah,
on?
sure.
I think everybody should hear. Collins and others, I would like to make a comment here on things fall apart. I hope this doesn't include health issues falling apart. This is because with multiple responsibilities that women shoulder, both at workplace and in the domestic realm, we must emphasize on women health as well, which often gets ignored. Caregivers don't usually find time to address their own health issues. Health is wealth, we realized more from the pandemic.
Yeah, this is, I mean, certainly the case, right? And clearly, if you look at women's health issues, it's certainly neglected, and caregivers are face the brunt of this, right? You sort of have this. I mean, clearly, health is really an important thing. I should point though that in the narrative that I was putting up of things falling apart, I was actually referring to more mundane things that Siddharth Mukherjee was talking about. I was referring to the what he considered the mundane, everyday things that seem to be part of our lives. That men seem to have a way to avoid these, and women seldom do. But I do agree with you that health falling apart is something that really shouldn't happen, or that women would also bear the brunt of something like that.
Yes, Collins, I did realize from your talk, it was just that I wanted to mention this point because it's very much valid, right? The health.
I do agree. I do.
It's also very little research of women's health in general. Yeah. We have a question from Purnama in the chat. And I think this would be to Anindya, but I would it would be nice if others could also pitch in. Is choice really personal? Is it not also a cultural construct? If a woman has seen many other women putting other careers on hold for childcare, that option as a choice comes naturally to a woman than a man. I would like to hear from Dr. Rana about this.
Could I start by responding?
Yes, of course.
Okay, thanks, Purnima, for that very important question. I don't know where to start, but let me quickly clarify one point, that even if women are putting their careers on hold for childcare by watching other women do it, it's still a choice that she's making, right? And what you're questioning is how much of free will exists in that choice. And I completely agree with you there. And I'll just give you two examples here that I draw from biology. It's absolutely remarkable that there were experiments done on swordtails, which are Amazonian fishes in an aquarium, where we all know that millions of years of evolution has selected female swordfish to choose as mates males with longer tails, right? And Lee Dugatkin did these series of experiments where he tested in the aquarium female swordtails and who they choose as mates, right? And invariably, every female swordtail that he tested chose a male with a longer tail, right? When a choice was given on either side. However, when he pushed a female who had made this choice to one side and allowed her to watch another female actually choose a male with a shorter tail, and this Dugatkin did by pushing a glass wall against this female fish. So she was forced to swim against the male with the shorter tail, separated by a glass platform, of course, a glass wall, of course. It was incredible that in the next choice, this observer female now chose the male with the shorter tail. And what Dugatkin showed in this PNAS paper was that million years of evolution was overturned by a single observation that a female swordtail made of another female swordtail, and a culture was born, right? So how biological is culture? What kind of forces act when, let's say, a human female is making a choice is really something we need to understand much more. Of course, in many cases, there are overt demands that are made where a female human, in this case, doesn't really have a choice of what she should be doing. And I really don't know how to set that right. It is, again, as I said, a very individual decision, a very individual relationship, an individual atmosphere in which a man or a woman is living, which will allow her to make these choices. So I don't think I have an answer to your question, except that each of us needs to be extremely conscious of how much freedom of decision making exists in all of us, man or woman or anyone in between, about the kind of decisions we make. And one last point I want to make, sorry, I may be taking a bit too much of time, is that what one cannot ignore are the biological propensities as well, right? Now, it is true that, and I don't want this to be, I'm not making this as an argument, I'm just looking at it as an observer. When a female has childbearing capacities, which include, for example, bearing in their womb a child or lactating for a child, there's just so much a man can do in that connection, right? So in some sense, there are certain biological predispositions, perhaps, which may appear. And I think we need to be aware of them. And this, again, as I said, is a continuum, right? So a woman may bear a child and may lactate, but perhaps all other caregiving can be done by a man who did not contribute to those stages, but took on at a later stage. So where one decides is the right action and how much one is capable of doing is something perhaps that one again needs to work out through discussions, through thinking about it, through various means. And I'll just end with one last story, which I heard from my mother, which I think was absolutely a beautiful story. So she said that when India became independent, Padmaja Naidu, Sarojini Naidu's daughter, became the first woman governor of an Indian state. She became governor. Pandit Nehru announced that Padmaja Naidu would be the governor of West Bengal. And my mother said on the radio that she heard on the radio an interviewer asking Mrs. Naidu, what was your first thought when you heard from Pandit Nehru that you would be the first woman governor of an independent Indian state? And Padmaja Naidu apparently laughed and said, I thought of which sari I would wear at the swearing-in ceremony. And my mother loved this story because she said that freedom lies not in denial. Freedom also lies in celebration of what one is, of who one is. And I think that's an inspiring story because it tells us that every individual has to define for themselves what roles they fit into and what they should do, and how much freedom, of course, they have needs to come not only from within them, but of course from the environment as well. I mean, nobody can deny that. Thanks. Sorry, very long answer.
I think that was a beautiful answer. Others on the panel, Shanti, Swapna, Collins, do you think it's really choice if it's culturally ingrained in us to do a certain thing?
So I think I agree on many points to Dr. Sinha. I think it's a conscious choice and it's a compelled choice. A socially constructed compelled choice which is coming out of peer pressure, some social constructs, replications over the generations to do certain things only because others have done imitation, is a compelled choice. Whereas a well thought, conscious choice, where my agency lies, my willingness lies, is could be a very happy choice. And if staying in the same stereotypical environment, it could not become it could not hamper the labels of choices given to women as opposed to work that they need to do.
I think I should just give me a second. Sorry. I should add to this a little bit in that, uh, I loved your story about the short-tailed fish, but I think that there is also it's often, and I find a very strong propensity for people to use uh, evolutionary stories uh, to find ways to justify uh, social constructs that shouldn't be there. And I think that there's always a real danger that we end up looking at social constructs and assign evolutionary answers to them when the answers are perhaps merely economic or some form of patriarchy. And one really needs to be careful about separating these elements.
I think yeah, because I guess you could find another example to justify the opposite of, yeah, using evolutionary stories are tricky. I did want to add a little so when I was understanding these things about choice, I for example, if you take dressing, I mean, the clothes that you wear, and if there is one side that's saying that women should dress conservatively, that is obviously bad. Now we know that, but the opposite. This is a hypothetical scenario. If somebody was saying that women should, dress very freely and pick apart people who dress conservatively because they're comfortable, and to say that oh, it's society that ingrained you to dress this way and that's why you're dressing this way, I think that the other person picking the woman apart is also still telling her what to do. So either way, if somebody is telling the woman what is right for her, it is not her agency. So if a woman by conscious choice finds something more comforting than the ideals of our world, where you would think that the ideal is something else, she should still choose. She should still have the ability to choose something and to choose against the ideal if needed. The freedom comes from choice and not what you choose. Yeah, that. Sorry, panelists should be speaking. Other questions?
Can I just make a point, Nikita? This is a battle that I have with my daughter occasionally. And this battle is really about whether she can wear whatever she wants when she goes out, versus me asking for clarification about where she's going and whether she's dressed appropriately for where she's going. Now, the concern of being appropriate is not at all for me a cultural construct, because she knows that on occasion she wears anything and I never stop her. But on certain occasions, I may be a little concerned about her personal safety. And say what you will, the point is we could theoretically argue about freedom and free will and choice to do whatever I want. But I do think that at least my daughter, who's currently 22, perhaps has less experience than I have in what she should wear in certain, let's say, parts of the city, maybe even certain parts of the city at certain times of the day or night. And that often becomes a battle of this free will versus my sort of advice against her free will. And who's right? Right? There is no right or wrong, right? So how does one take a decision? What do you then do?
No,
what
so
do you say?
As a 22-year-old, I would think that I'm sorry, but I'm going to take her side on this because I have a different answer. No, the point is that she has already thought about this. She is also worried about her own safety, and she's an adult now. And it's only after a lot of internal self-shaming that women actually choose the clothes that they want. So if she still decided after all this to wear whatever she wants, then it's probably been a big leap for her. But if you think that she's actually being reckless, then I mean, that's a separate
I
debate
think that's
between
the
you
point.
two.
I think there is individual variation.
Yeah, there is
There's
individual variation.
And with one individual, you might advise in one way, and one individual you would not put forward any advice at all.
Yeah,
That, of course, comes from experience and your of dealing with the thing. But these often become, a matter of perspective, unfortunately.
Yeah, I think that this is a very subjective. Yeah. More questions.
I have to make a comment here. Purnima says, I think the start point for change is for every individual to know and to be made aware that they have a choice. And I completely concur with her. We need to have processes in place, and we need to make sure when we raise our children that they know that they have what is being referred to as agency, personal agency, right? Everybody should be made aware of the fact that you have the right to make a choice. One needs to just provide all the relevant information, all the wherewithal for them to make this or invoke this capability that they inherently should be, I mean, it should be made known that they possess it in the first place. And I completely agree with that.
Sugita asks if these are discussions that boys are also having with their parents. Do boys have to ask their parents about what to wear? I think that's very intense food for thought.
And I just responded. I responded to Suhita by saying absolutely yes in my own family, because we often visit some very elderly relatives, and I tell my son, let's not wear shorts, simply because I think these elderly individuals whom we are visiting may not like this, and sometimes I think we dress with others' concerns in mind as well. And you are wearing a short all the time, but if I request you not to visit a particular elderly family, a family of elderly members, I guess that's my point, right? And another point I want to make here is I agree that yes, these are the starting point, as Purnima says, is to have a choice. But I just want to add on a point is that how this choice is shaped, how much of this may be intensely genetic, if I want to say biological, or how much of this is physiological, which is the microenvironment, hormones, how much of this is pure cultural constructs is often difficult to define. And we have n number of examples from biology, which I don't want to use as justification, but I do want to cite them as explanations of how sometimes it's very difficult to distinguish between what is a social construct and what is a biological drive.
I think Professor Anirban was saying something. He unmuted himself.
Yeah. I tried to. I was going to ask a different question. So for some reason, I'm not able to start my video. You did some blocking, which is even blocking current videos, but that's fine. Doesn't matter. I don't need to.
I can make you a co-host.
No, forget it. No, I was just curious to ask the students whether this pandemic was particularly harder on female students. That was sort of my question compared to male students.
Definitely.
And if you could give some examples and why it was like that, that would be helpful.
Swapna, do you want to go first?
No, you go ahead.
So I come from a very nice home. So I made it a point to fight with my brother and make sure he was also doing a fair share of work. I think the only difference for us was that it would come more naturally to me, as in I would know what work there was. Whereas he would have to be told what work there is to do, but there was willingness from both sides to share the household chores. But I do know of friends who, once they went home, despite being away for 3-4 years from home, the moment they return home, the fact that you're a female at home suddenly brings on, like, you're expected to do everything that your mother was doing. And right, 3 years ago, your mother was doing everything. You were helping her then. And now that you're older and your mother is doing everything, you're also going to be expected to do similar things as her, irrespective of studies and meetings and whatever that you have. This sort of comes first. Yeah, that people come from all kinds of homes. So this still does happen. Swapna, I think you can go now.
So I agree with Nikita. Of course, this is a scenario that I have seen, heard, and learned about. But yeah, I think I'm not equipped to personally add anything to it because, as I mentioned in my talk as well, that I come from a very blessed home, and I don't share a large percentage of chores at home. Like I cannot step into the other woman of our house, like my mother. I cannot step into her house. She is way more equipped than me to do things. So all the other two genders, me and my dad, both we could do was help her out. He was a male, I was a female, but since we both were not as equipped as she was, we could do all was to help in whatever thing we could. And I think I have always been in more or less this scenario. So as a student, female student, was pandemic more stressful because of domestic work and the balance between work and life balance. Uh, I think uh, zero on that from my side, like a personal side.
I'd
So,
like to add.
so I, yeah, go ahead, Sudha.
Okay. No, I just wanted to quickly point out that I am aware of certain examples, particularly from male students who belong to economically challenged backgrounds, where everybody was expected to share the load. And I know of students who actually had to go out and make a living, eke a living, because they really belong to backgrounds where if you did not go and work on a daily basis, there was no food on the plate. So I think a lot of this answer also gets colored from a economic perspective. So if you are from a well-off background, the choices come down more to I'm the girl, you're expecting more of me, you're the boy, folks don't expect as much as much from you, so on and so forth. But then the second the economic disparity kind of kicks in, right? The second you look at it from a different lens where money is a big issue, then everything changes. Everybody, all hands on board. What the girl child does versus what the male child does, maybe that'll be different, but otherwise, all hands on board. And we have examples very much from IISER campus where boys had to work extensively during the lockdown too. So I just wanted to point that out.
Absolutely.
So I should point that there have been some reports that, or some of the students reported that alcoholism at home was an issue. Living in extremely cramped spaces with people who were not very supportive was an issue. I do believe that our counselors' phones are ringing off the hook through the pandemic. Now, we of course have. I don't think we know how much of it is men and how much of it is women, but I think one could safely guess that household work would certainly be a woman's burden, going by most statistics.
I think we have time for one last question. Any pressing questions, people? Sunil says, while it's good that we're talking about the last year and the pandemic related problems, perhaps we must also focus on how much our institute or any institute is gender neutral. And I couldn't agree more with what Sunil says. Anybody wants to take that?
If I can have just half a minute to also add to the question. I joined IISER in 2012. And I found soon after joining that the security guards were telling girl students that they must go home from the HR4 building, which was then the hostel. It was then the guest house and the hostel had been built. They must go back to the hostel. And once they were in at 11 p.m. and once they were in the hostel, the women guards on their floor were telling them that they must also go inside their own rooms and go to sleep. While the boy students didn't have to either go to their hostel, nor if they were in the hostel, did they have to go to sleep at any time of not of their choosing. And what I always wondered was, how did this, IISER had already been around for 3 or 4 years. I joined a fully functioning institute. How did nobody, I mean, it wasn't like people were raising hell about this. And just to give a bit of history, the hell really broke loose when a PhD student wasn't allowed to leave the campus at 4 in the morning to go to Bombay in a taxi to get a visa with the full approval of her advisor. But the boy who was also going with her was also getting a visa. The guard said, no, he can go. You can't leave the campus. The taxi waiting outside the gate, the advisor saying, I know that she's going to Bombay to get a visa, but there was a certain extra step they had to go through to get this approval. So this complete lack of agency for women students in our campus, it left, I don't want to keep harping on the past, but if we were like that, surely dozens of institutes in India, and I don't mean the IITs, but I do mean other residential campuses, must be like that today. So just wanted people's thoughts on that.
That is, as someone who lives in the hostels presently, that the whole prospect of that is just horrifying, and I can vouch that it does not happen anymore. And I'm so happy it doesn't. Oh God, imagine a guard stopping me.
I should also at this point maybe bring up, since Sunil mentions whether we are gender neutral or not, our students carried a really brave report in the student magazine about sexual harassment. And, while the Institute, of course, tries to minimize these sort of instances, it's clearly not gender neutral by really extensive reports from our students, who showed a great deal of courage. And of course, they were also supported by the Institute. But given this, I think it's important to maybe sit and evaluate how gender neutral we actually are. We need to have look at some sort of a metric, and I think Suhita brings this, has this up in the chat, of doing a third-party survey or a study to understand gender parity in the institute. So there are certainly instances where, in fact, a large number of instances, given the world that we live in, where there is no gender parity, and we really need to study and understand the extent of it.
So I think I'd like to add, since I've been a hostelite for quite a few years and I've heard stories about institutes and hostels from all over India. Though, as Dr. Mukhi mentioned, any of those things don't happen in IISER Pune right now. But there are many institutions in the country which have curfew times, especially for women, from 7, 9, 10. Hardly any curfews go beyond 10:30, and a curfew for a women's hostel is a must. There is no women hostel which runs without a curfew, if it is a working women's hostel, even if it is a student hostel. And in fact, in many institutions, as we were discussing about dressing, there are many institutions which have peculiar prescribed dressings for women, where you are expected to have a dupatta, scarf, something on your hand, and wear it compulsorily within the institute. And as Dr. Mukhi mentioned, go back to your own building and your room, and your lights have to be shut off by the curfew time. If it's 9, then you can't do anything beyond that. I mean, you can't. Men can go out and party, but you can't. I'm not saying you want to, but this is a disparity. While against that, one of the institutes that I've seen is the women's hostel was quite removed from the main campus, and people had to cross a very horrendous highway to get their food, and they had to struggle to get the mess at the ground floor at their own building. Whereas this mess that I'm talking about, which was on the other side of the big highway, was right next to boys' hostel. So you don't want your women to step out after 9, but you can put their lives at stake just before you give them some food. Like, this is everyday hostel food, and this is in an area where there are no restaurants, and this is a time period before Zomato, Swiggy, everything was in vogue. So these things are also very common.
I think the simple fact is that these kind of decisions, like where a women's hostel is located and what women are supposed to do or not do and timings, are typically decided by men, although there are women hostel wardens who also have very regressive views. But typically, the architect and so on, when they are thinking it through, I mean, just to give you another very silly example, which I love to talk about, in TIFR, when they installed electric hand washers in the men's bathrooms, where you just put your hand in hand dryers, sorry, not hand washers, where you put in your hand and it dries, blows hot air. They didn't install them in the women's bathrooms, and nobody knew that it was so, and nobody knew why it was so for 10 years later. 10 years after that, until men and women discussed bathrooms, and suddenly the women were like, what hand dryers? We don't even have hand dryers. Now, how could this happen? It's a very trivial incident. Hand dryer is not an essential item, but how could it happen? Like, who was thinking what? I mean,
thinking is more like
you almost don't want to know what they were thinking, but there was a little extra money and they bought hand dryers for the men's bathroom. So this is how, so participation of sensible people, primarily of women in deciding their own how their hostels work, but also of just generally sensible people, is a must, and we should make that happen certainly in our institute and wherever we can.
Yes, that is the UN theme for this year. Women in leadership. Women should be making these decisions. Devapriya raised their hand.
Because Sunil brought it up, I also couldn't resist to, share similar experience. So I was in IISER Kolkata, and during the new set of hostels were being made, it took us a lot of convincing to do the architect that we don't need, toilet stalls in all the hostels. Because his point is that's what the standard structure of a hostel looks like, hostel bathroom looks like. Why do you need a full-fledged toilet for the ladies' hostel? So it really took us an hour to convince him that it's not a hostel with all the same design. The second point came after a couple of years, where we requested that, all the sinks are, sinks or the wash basins that are installed in those toilets are actually much above the average height of an Indian woman. So literally you cannot wash your hands without completely wetting your clothes. Again, something it took 3 years to convince them to change them. Finally, before I left, it took an entire meeting where I had to describe the steps of peeing to convince them that we need a hook in the toilet to put a bag. And thankfully, all the hooks were installed in all the toilets, in the ladies' toilet rooms, in the common area. So I'm glad that this topic was brought up, because these are the very simple things that people are extremely resistant about because they think it doesn't exist. And about the hostels and the facilities, the primary argument comes from the number. It's always that, it's primarily going to be a boys' hostel. The hostels are primarily designed by the boys. And that goes back to the entire thing that the ratio is so skewed, and that's not a fault of any specific gender. And that's where everything goes between. It's almost like justification by number. And I think these are the connected issues that we tend to ignore. But just to leave the last note, I joined IISER Pune almost 1.5 years ago. But till now, whenever there is a change of guard in the security, outlet in the, not the main entrance, but the entrance towards the Pashan Road, so they will always ask my ID before letting me enter, but never ask my husband's ID whenever we enter. My husband is not an employee of the institute. So with that, I'll stop.
I think I can't help adding one more thing. You know, before lockdown times, I used to get visitors from Pune who I happen to know, scientists who might be passing through or something. The only one who systematically gets stopped at the gate is Rohini Godbole. Okay, who's also like the most of all the scientists from Pune who visit me, she's by far the most famous. Okay, but so I actually had to speak to Avinash Avale about this, and I said, I think your guards are missing some point. I don't know what exactly they're checking for, but you need to talk to them. Unfortunately, though, there is no institutional mechanism even at IISER, and I hope WISC can look into that. You know, WISC can, if they want to be, how to say, if they have the time, because it's a tiresome job, send somebody to the gate and check how often women are stopped and men are stopped coming in, and ask questions about it. And ask the guards, frankly, like, do they feel that they have instructions that a woman is less likely to be coming to IISER for science? If so, they are misinformed. And then, you know, once they are told, the guards are not bad people. What they think are the instructions given to them that they're following. So somebody has to do this.
I think we're a little over time now, but before closing, I think to wrap up this discussion, it would be really nice if Shanti, you could talk for maybe a minute about gender parity in admin, because I don't think we have such conversations often. Do you feel like there's how do you feel as a woman in the IISER admin, I guess? And if there's anything relevant to this discussion that you would like to add.
So to be honest, I had not thought of myself as a woman professional for a very long time. It was only in the past year or so when I experienced a couple of instances, maybe 2 years or so, when I experienced a couple of instances that I wondered if it is to do with my gender for the first time. Clearly, there is sexism in the society, and IISER Pune, whether it is students or faculty or administration, they are not immune to it. And this is a problem which is actually not easy to address, because it is a lot to do with awareness. Some of the issues that Sunil just mentioned about, as to how is it that someone gets stopped and not others, or why is it that there are no guidelines about it. I think once we recognize these as issues, two quick things one could do is, one is related to awareness, creating awareness that you cannot treat people differentially. Two is also to make it easier for people to follow some sort of a guidebook. Of course, not every decision one can take using the guidebook, but at least some of these aspects can be removed from the day-to-day decisions that people have to make. Like, I heard that certain children were not allowed to enter the park. And as far as I know, the IISER park, and as far as I know, there is no guideline that has come from the administration that you shouldn't. The instructions were taken from discussion with the residents. And clearly, if they have a guideline that you cannot take direct instructions from residents, any requests, such requests have to be channeled through this mechanism, then immediately they have an agency, the guards have an agency to take a call, rather than having to bow down to requests directly by residents, because it is really not their job to cater to demands by each and every resident, because it is actually impractical to function that way. So yeah, one is awareness, and two, guidelines. I think these two are important, like specifically from gender parity in the administration. I personally feel that it has been no different from what I have seen of awareness about gender-related issues among students or among faculty members. I actually don't have data for this, but from the discussions we often have in the internal committee and from the kind of feedback and the discussions and complaints that we keep receiving, awareness seems to be the most important missing element. For example, when I was growing up, I saw women take on more domestic work than men did. But at the same time, I also understood as I grew up that, and this was something that was again like how Anindya and Collins had mentioned, it helped a little bit to have more open-minded households. But even in the instances of where you're conditioned to think that when you enter a new house, for example, or when you go for a dinner, that you think of complimenting the woman of the house, that, oh, this is very well kept, or this tastes good, assuming that they were responsible for that particular role. I did that when I was 25. I think it was an unconscious bias that I had, and it only required a minor comment from somebody I knew that, you know, I work too in my household. So a simple comment as that, if we are open to receive those sort of comments and make amends in our understanding, I think that really can bring about change, and that is probably one of the big ways in which change can be brought about. So so discussing about these topics, not just in committees or not just when we have an occasion to talk about it on a Women's Day. In fact, I feel that it should be renamed as a day for inclusivity and diversity, and not just as a women, because these are not necessarily only women's issues. These are everybody. This is an everybody's problem, yeah. So I think these are the two ways to go about it in my head. One is work towards awareness, and the other is bring guidelines so that it helps, it empowers people to not to take these wrong decisions.
I think that ties in very nicely about with what you said before about alternatives to calling out. I think amongst our circles, when there isn't too much of a power imbalance, it's easier to reach out, you know, the olive branch and help them understand as opposed to shut them out, and have more discussions of this sort. I think that is sort of the only hope I see for major change. Yeah, I hope more of these conversations happen. I think we can close now.
So I'll just take this opportunity to thank all the speakers who very graciously spent the last 2 and close to half hours with us. Thank you very much. Thanks a lot. Thanks a lot. Appreciate your time, your effort, and appreciate the fact that you've come to share all, I mean, you joined us to share all these thoughts of yours, and I thoroughly enjoyed the discussion, and probably we can take this forward via emails if there's more of it. Thank you, audience, for your participation and for making this event a success. And thank you, Nikita, for stepping in and doing a wonderful job with hosting. Once again, apologies for that absolutely shocking Zoom bombing. I hope that will never happen again. And with that, I shall say adieu, and we hope to see you in more of the Women in Science Committee events that we organize. Thanks a lot. Ciao.
Thank you.
Thank you very much, Nikita.
Bye.
Thank you, everyone. Bye. Thank you, everyone.
Thank you.